Welcome to our third episode of a closer look at the opioid crisis in our city. The impact of almost daily overdose calls creates a risk for first responders who treat fentanyl overdoses. I spoke with Fire Chief Ed Elliott, who addressed the risk and how the demographics have changed for overdose calls over the last 10 years. So what is the process for first responders who respond to an overdose scene?
So when the call comes in, and we have a prescription for every call that comes in, and based on that prescription is the level of response that we will dispatch to that particular EMS call.
So Chief, what is the risk of fentanyl to first responders who may respond to a scene of an overdose?
Actually, before they arrive on the scene, if that call comes in as an overdose, that requires a special level of personal protective equipment. We call that PPE. And because of the toxicity of certain opioids, in particular fentanyl, they know that when they go in there that not only are they working on a serious patient, but they're also working in a hazmat environment because that fentanyl could be up to 50 times stronger, more lethal than something like morphine. In the last 10 years, and if we go back to 2013 in particular, you'll see a dramatic increase in opioid overdoses. If we go back prior to that, most of our overdoses were classified in a particular demographics, in a particular location in the city. Some people would call those crack houses, vacant houses. The drug addicts would get into those, and that was regular, but not as frequent. But that's what we were used to prior to the opioid crisis. It's changed. It's no longer in the crack houses. It's no longer in the vacant buildings and in the garages, but it could be in any neighborhood throughout the city. That's changed. The demographics has changed because it has affected so many people that it's spread right across all demographics and all locations in the city.
I wanted to know if first responders can experience PTSD or secondary trauma as a result of responding to an increase in overdose calls in addition to all of the other emergency calls. Chief Elliott explains how the fire department supports and recognizes the importance of addressing these concerns.
There's a cumulative stress that builds up that can eventually, if not without intervention, can lead to full PTSD. We try to get on that continuum, stop that early in the process. Opioid overdoses in particular respond to those. Like many other calls, we train our folks from the very beginning that when you respond to an EMS call, you don't have just one patient. You have a primary patient that's in distress, but you also have other patients, the family members, the loved ones that are surrounding that patient, is we remind them that those are patients too. They may be emotional patients and psychological patients, but we need to tend for the surrounding family members as well as the patient that's in most need of EMS care. And the crew that came on duty today, before they get off, we will run over 100 calls in 24-hour shift. Every week we run 700 or more calls, and if you're constantly responding to those traumatic events, it can weigh heavy on you. It can have traumatic results. From the very beginning of our recruit academy, we start training our recruits in stress awareness. We want them to be aware of it. We want to teach them as recruits of how to deal with each other, how to take care of each other. You move that from the recruit academy, and in our officer development program, once again they're exposed to psychological first aid, how to tend to those that you're responsible for. We have our chaplaincy program. Those chaplains have been trained and certified in emotional care, behavioral health care, PTSD, so they have that training. We have our own peer stress team in the department that are trusted by the members. We can call them. We can direct them to a higher level professional care through EAP. And then one of the things that we worked hard on over the past several years is removing the stigma about any emotional care or any traumatic event that may impact you. And you know, we've taught the message and we've tried to get the message, it's okay not to be okay, because we're all human and it's a natural response to what we see. Our folks go out and they see things that you can never unsee, and if we don't deal with that, and if we don't help our folks deal with that, then that will accumulate. So in particular, we're talking about the opioid crisis, but that's relevant to every response that our folks go on.
Are first responders noticing a specific demographic when they go on overdose calls? How are they dealing with the additional stress that may be brought by these calls? What role does Narcan play in treating individuals who have overdosed? I reached out to firefighter-paramedic Angel Santiago to help answer these questions.
I think the interesting thing with the opioid crisis is that it really doesn't have a specific demographic, right? You see people of lower income housing, you see people that are middle class, and you see people of high class as well. You see mothers, you see daughters, you see fathers, you see sons, you see brothers, sisters, wives, husbands. You see a whole array of different people. So it really goes to show that the opioid crisis can affect anybody. Addiction doesn't have a filter. It picks and chooses, and once it gets you, it gets you.
Can you talk about any additional stress that may be experienced by yourself or other first responders for these types of calls?
Absolutely. So definitely stressful. You have all different types of patient demographics. Like I said earlier, wives, mothers, sons, brothers, sisters, young kids, teenagers, all the way to the elderly that are affected by this. And with that combination of stress and lack of sleep, it can be very easy to kind of have those secondary stressors affect us outside of work, where it comes into play having that tight-knit community around us. So as far as our station here and within the Chesapeake Fire Department, we're very tight-knit. We tend to look out for one another and kind of fall on each other when needed. So also a good thing is that the city has different peer support groups. They have the critical incident, scene management, so that helps out as well.
Can you talk about Narcan? I know you carry it with you when you arrive on a scene. Can you tell us a little bit about how that works to help someone who may have overdosed?
Absolutely. So for us, our criteria for delivering Narcan is you're going to have a patient that has some form of alteration in their mental status. Typically, they're going to be almost unresponsive. They're going to also have a decreased respiratory drive. They'll have those pinpoint pupils. And depending how long they've gone without breathing adequately, they may have pale skin, cyanosis, which is just the blue tint or palish tint to the skin as well. So once we have all those symptoms together, we go ahead and we deliver Narcan. What Narcan does is the opiate itself wants to attach to different receptors that are inside of the brain, and Narcan has a higher affinity for those receptors. So Narcan does is it goes in and attaches to that receptor that's inside of the brain. The opiates also want to attach to that receptor, but the Narcan has a higher affinity for it. So it gets rid of the opiates that are on that receptor and prevents any further opiates from attaching to that receptor, which will then in turn bring up the patient's respiratory drive, which is our goal.
We would like to thank Chesapeake first responders in both police and fire departments. Their expertise and dedication to saving lives in these opioid-related emergencies is truly admirable. On our next episode, we'll talk about solutions, programs, and support. If you or someone you know is struggling with addiction, please seek help from qualified professionals and support groups. I'm Karen Myers. Thank you for watching.